Welcome to the Empower Hour, guys. I'm Miley Scarpino. I'm your host, and today I'm here with my dad. Yay! John Scarpino. He's an orthopedic surgeon at Honolulu Sports Medical Center. He does occupational medicine there. And today we're just going to be talking about a whole bunch of different things. We're going to be talking about medicine. We're going to be talking about nutrition and health and training. My dad has a really wide background in training and health and nutrition as well. And then we're going to be talking about children in sports and being a single parent, because he was a single parent raising me for a while. And I definitely have a sports background. So we're going to be touching bases on all that kind of stuff. So welcome, Dad. Do you want to tell us who you are and just a bit about yourself?
Sure. My name is John Scarpino. I'm an orthopedic surgeon and Miley's dad. I have a wide experience in orthopedics, in sports medicine, in spine surgery, in treatment of complex spinal problems, chronic pain management, and I'd say one of my special interests has always been sports performance and helping people to perform better within the limits of what they have.
And I definitely got a lot of that from you. Mechanics. Miley, your knees are pointing in. We need to fix that. Miley, all the time, constantly. So that definitely did help me, but that is a passion of yours.
Yeah.
I saw that firsthand growing up. So what got you interested in medicine?
I had never planned to be a doctor, to be quite honest with you. And when I got to the end of my college career, I was planning to go in the Army because I'd been in ROTC. And at the last minute, they gave me a deferment for some unknown reason. I had nothing to do. And our doctor at that time was Dan Hanley. He's Olympic team physician. And he said to me, he said, "John, you've had so many orthopedic injuries, you already know how to treat and then when what's necessary for most common orthopedic problems, so you should be an orthopedic surgeon." And he convinced me to stay at college for an extra year, pick up a couple of courses, and then go to medical school. And I went from medical school to orthopedic residency and became an orthopedic surgeon at his insistence, sort of.
So besides medicine, what else encompasses your life?
I really like to train still. I'm very interested in performance. I read a lot of medical journals, both in my specialty and in other specialties. I'm interested in other things too, Eastern things like yoga, Reiki, and I'm actually a Reiki master.
Why don't you explain what Reiki is?
Reiki
a lot of people
is,
don't know what
well,
it is.
I mean, actually, in the United States, that comes from Hawaii. Miss Takata was a student, a patient, and then a student of Dr. Usui's in Japan, who was the enlightened person that started Reiki. And Reiki is an energy technique where the Reiki practitioner channels energy to their patient's body to help the body heal, and opens up the energy channels for the person. So I've been very interested in those Eastern kind of techniques. I also have basic training in Qigong with Chile Qigong, and then with the people at Learning Strategies in Minneapolis.
Why don't you explain what that is?
Well, that's another kind of energy medicine that's a little bit different, because the practitioners in Qigong actually direct the energy to the, and they use the energy to correct the problem, where is when you do Reiki, you give the body energy, but you let the body do what it wants with it, and you don't specifically channel it. But the Qigong practitioners channel it, and there are some amazing results with that. There's a book that was published of 100 miracle cures that comes from from the big Chile Qigong hospital in China, with 100 people with incurable illnesses that were cured at that hospital with Qigong. And I've actually seen a video that he brought back of a patient with a huge bladder tumor, and watching the bladder tumor on fluoroscopy while these 4 Qigong masters worked on it at the same time, and just watching the tumor go away in real time.
What's a fluoroscopy?
It's a machine with X-ray where you can look inside the body and watch things in real time as they're happening.
And it actually went away.
It's actually like moving, and it went away, and I didn't believe it. Of course, and I went up and talked to the teacher after that, and he said the same thing to me. He said, I didn't believe it either. He said, so I went back with the radiologist the next day, got the machine out again, and had that patient come back and looked at the bladder from every possible angle to see if the tumor was there, and it was gone.
See, because that kind of stuff always interests me, because I do believe in the placebo effect. So I guess I'm always skeptical about, but with that, there's no way that you could...
Well, don't be skeptical about placebo effect, because placebo effect is not what people think it is, okay? You think the placebo effect is, oh, somebody thinks it's going to make me better, so in their brain they think they're better. That's not really what placebo effect is. There are functional MRI studies done now looking at placebo effect, and what you find is that it actually changes the patterns of activity in the brain, and it changes the conduction of inhibitory signals from the brain to the spinal cord, and it actually inhibits sending pain messages. So placebo really has a physiologic function in your brain, and it changes how messages are transmitted to the brain and then how they're transmitted in the brain. So it's actually a physiologic process. It's not just, oh, I think I'm better. And that's proven now.
Explain what physiologic is.
That means that it's actually a demonstrable process, a change in how your brain works, change in how the neurotransmitters work, change in how messages are transmitted inside of the brain. And that's proven now with functional MRI. You can take an MRI, you can give a person labeled glucose, labeled sugar, which is the molecule that your brain burns for energy. And you can watch where that goes with the MRI studies, because different areas of the brain will light up, and you know how the brain will normally light up in a pain patient. And then with placebo, you can see how you change that and how it lights up in a different way, and different areas are active in a different sequence.
Well, that's really neat.
Yeah, so you can prove it.
Oh, I just learned something.
Yeah.
Thanks, Dad. Why don't you also talk about like your training and your background in training and...
You mean as far as weightlifting and
yeah.
that thing? Well, actually, I started
from.
out in high school as a swimmer and a runner, and then they tried to convince me to play football because I was pretty fast, you know, and like a 900-yard dash guy. But when I put on all that equipment, I weighed 135. And when I put all that stuff, I was like a turtle. I couldn't do anything. And my football career ended with a torn ACL, torn anterior cruciate ligament, and a bad knee injury. So after that, I just swam and ran. And then when I was later on in college, I got more interested in weight training. And then when I went to medical school, I got more interested. Then I got interested in martial arts and started in judo, and then eventually progressed to karate, and then to full contact karate. And I was the medical advisor for the first professional full contact karate association, the PKA. When I got to my residency, that's when I really got interested in weightlifting, and I trained at that point in time with a bunch of guys that were world champion weightlifters, the world record holder in the deadlift, Don Cundy, Jerry Jones, the first guy to squat over 800, Mel Hennessy, first guy to bench over 500, Mike McDonald that held all the bench press records from 148 to 275, Ken Patera, our first Olympic guy to press over 500 in the Olympics, to clean and jerk over 500. And then all the wrestlers, Ric Flair, who became a very famous wrestler, was actually my training partner at that point in time. And so I got very involved in powerlifting at that point in time.
How has like health and fitness impacted your life?
I think without training and fitness type activities, I never would have been successful. You learn so much about yourself through training, and also you make yourself more able to do things. I mean, it's a relief from mental activities, and
it really is such a psychological aspect.
And it gives your brain a chance to recover. It teaches you to delay gratification and to, work towards a goal. It teaches you to organize your time. It teaches you to be in touch with your body and understand the difference between fatigue and training pain and injury. You just learn so many things from training. And the other more recent data shows it actually has a very beneficial effect on your brain. There's a compound called brain morphogenic protein, and that serves to renew the neurons in your brain and in your peripheral nerves. And exercise is one of the major stimuluses for that. So when you exercise, you're actually fertilizing your brain and allowing it to make new connections and become stronger.
New pathways. Okay.
They actually did a study in Illinois where they took school kids and randomized them to two groups. One would come in before regular classes and do an exercise program, and the other would just come in regularly, and they'd all go to class together, same teachers, no difference. And then they looked at their improvement in performance in grades and in on the standardized, national tests, and the kids that came and exercised early did much better than the kids that just came regularly. And the gym teachers all said, we fertilize the brain, and the teachers cultivate it, and we produce superior students and athletes. So there's a real positive effect on your brain as far as its learning ability and as far as its growth with exercise.
And you would hope that would get translated throughout the U.S.
Yeah, it doesn't, though.
I know.
I think things are going the opposite way. If you look a lot at schools now, they're backing away from the athletic programs for kids, like gym class for an hour every day and things like that, which are really, I think, important for the kids' ability to learn, for their physical fitness.
Completely.
And also to teach them things that they can do for the rest of their life to stay healthy and to stay fit. And I'm disappointed that things are going that way. I mean, maybe I'm old-timey and it's like I'm saying, you get to drive to work and I had to walk 5 miles, but I really think...
But it really is important.
Yeah,
it's an important aspect for kids to learn about their bodies and to learn mechanics and to understand how to run and to, do a push-up and everything like that, or play basketball. Yeah. I know when I went to Ilani and even when I went to Le Jardin, we would have months where we would do different things. We'd play handball or basketball, soccer. And so you got to learn about different sports and kind of see what fit in with you and what maybe you wanted to do outside of school. And I think not having that, how do you know what you want to do or where you really fit in, or how do you even get involved in sports? And that's that was the next thing I was going to ask you is, like, for somebody that wants to start getting involved in health or nutrition and they're a newbie, like, what do you recommend? What's the first step to do?
Do you mean as far as physical training is concerned, or diet?
Yeah, physical training and diet. And that's kind of a hard thing to do together.
It is to an extent, but I think the first thing you need to do is you need to decide what your goals are going to be from your training. Are you aiming at improving your performance in a sport, or are you looking just for, general fitness? I mean, if you go to the gym and lift weights, that's a non-specific way to improve your performance. And then you have to take those increased gains that you make in strength and endurance from that type of training, and then you have to apply those to sport-specific activities through play and through practice in that sport. Because to learn, the Russians have done a lot of research looking at that, and it takes about 3,500 repetitions of a specific sport activity
to make a new
to
habit,
facilitate the neural pathway in your brain so that becomes an automatic response. And the martial artists feel that it can take up to 10,000 repetitions, or repeating a specific technique until you can be considered an expert in that technique. So it takes tons of sport-specific repetition to gain the skill, but the general strength and flexibility you can gain with just a general exercise program, and then you can apply that to any sport. So for kids, it's probably important for them early on to get the general conditioning first and then apply it to sport, and not get too specific about the sport really early on, and to actually try many sports when you're younger and develop, and improve your coordination. It's very interesting how things cross over.
We're going to take a really short break.
Okay.
And then we're going to get back into all of this.
All right.
I'm Miley Scarpino. I'm your host. This is the Empower Hour, and I'm here with my dad, John Scarpino, orthopedic at Honolulu Sports Medical Center. Yeah. Oh, I almost forgot for a second. Okay, we'll be right back, guys. Thanks.
Aloha, my name is Paul Jackson, better known as PJ, and my local interest is in sports. I have my own sports radio show at KWAI AM 1080 that you can stream live. I also have my own website, pjsportsradio.com. We have live guests in studio, and we talk about discussions and topics that everyone wants to know locally here on the islands. We cover everything from surfing to basketball to whatever's going on locally, sports-wise. We try to do our best and cover the topics in depth as much as we can. Once again, thank you for joining PJ here on Hawaii Sports Update. Mahalo.
Mahalo for watching Think Tech Hawaii. We are a channel dedicated to raising public awareness about the importance of technology, energy, diversification, and globalism to the future of Hawaii. We broadcast and stream daily from 1 to 5 every weekday, and we broadcast on Olelo 54 and OC16 TV. All of our shows are archived on thinktechhawaii.com, and we hope to see you there. Aloha.
Welcome back to the Empower Hour, guys. I'm Miley Scarpino. I'm your host. I'm here with my dad, John Scarpino. He's an orthopedic surgeon. He practices at Honolulu Sports Medical Center. And we were just talking about what to do if you're like a newbie and you want to get into exercise and like health-related things. Like, what do you do? And you were talking about for children, it's great for them to dabble into everything just so that they can get like a base and understand themselves.
And there's a big crossover between sports. I mean, it's really interesting. If you look at football, who are the best place kickers and field goal kickers? Soccer players. That's a crossover. If you look at mixed martial arts, who are the guys you don't want to kick you? They're guys that started as soccer players and now have moved to mixed martial arts. So there's big crossover between sports where you'll have one sport-specific skill, but it'll cross over into another sport later on that you may find that you're more interested in.
What if you're like an older person and you're not 7, 8, 9?
And you're an old guy like me and you want to go to training and not kill yourself in the process?
You're lying right now, because if anybody came to train with you, they'd probably die. How much do you deadlift, Dad?
Not much anymore.
How much do you deadlift?
Not much. I mean, I'll do 225 for 20 reps or something like that.
225 for 20 reps.
But that's not like 700 like I used to do when I was
that's still a lot of weight, though, at your age.
Yeah.
That's a lot of weight.
But when you look at training, there are arguments about how to train. What's the best way to gain strength? What's the best way to gain endurance? Can you do the two things together? Can't you do the two things together? And you have one group of people that says, oh, you have to train very heavy with low weights and big rest in between if you want to get strong. You have another group that says you have to train with high reps.
And that's how Dana Lynn Bailey is. She's somebody I really look up to. She's probably like one of my idols. She is a figure competitor. Well, I guess now maybe she does women's bodybuilding. Anyways, she just went to the Olympia, and her physique is amazing, and she trains very, very heavy and very high rep. Like, she needs a lot of reps, and that's just how she is.
Yeah.
It's like how her body works well.
Well, that was one of the next things I was going to say, is you kind of have to adjust it for each individual person depending on what their muscle composition is.
And what their goals are.
Somebody that has lots of slow twitch muscle fibers, they're never going to be a real heavy weightlifter.
And explain what you mean by slow twitch muscle fibers, because not everybody knows what that is.
You have two kinds of muscle fibers and then kind of crossover muscle fibers. You have a slow twitch fiber, which does not develop much power, but recovers very quickly and can burn oxygen to generate energy from sugar in the muscle.
Okay.
And so that kind of fiber can repeat almost unendingly without wearing out. And that's the kind of fiber that you see predominantly in people like marathon runners.
Okay.
And then you have fast twitch fibers, which generate a huge amount of force, but wear out very quickly. And they're only good for maybe 9 or 10 seconds, and then they're worn out. And people who have large number of the very quick fibers, they have to work out with low repetitions.
So it's like sprinters.
Short sets, like sprinters.
Okay.
Exactly. And then you have a crossover type of fiber. That is you, where you are not quite as strong for the ultimate one rep kind of stuff, but you have the ability to be almost as strong, but do it for multiple sets, because you have a muscle fiber that can both gain energy using oxygen and without oxygen by two different systems. And depending on how you train, you can actually kind of convert some of your fibers over to be that intermediate type. And the other so you have to base your training to some extent on what your fiber composition is.
But what if you're Joe Schmo from up the street? How do you figure out what your muscle composition is?
To some extent, just by how you respond to training.
Okay.
If you find you love doing 20 rep sets and that's what works good for you, then you train that way. If you find 5 rep sets work best for you, then you train that way.
Rep sets is like 20 reps, you're doing 20 repetitions for one set, and usually you do multiple sets.
Right, and you rest in between.
Right.
And you vary your rest. The interesting thing is that the newer data that's coming out now shows that it doesn't really make much difference if you work with high reps or if you work with high weight. What matters is the absolute amount of effort that you put into the exercise. You must go to failure at the end of the set. And if you go to failure, so you can't do another rep with good form, it doesn't make any difference how you get there, with high reps or if you get there with a really heavy weight.
That's interesting.
That's interesting. And, that's counterintuitive to what people have said for years and what the majority of trainers will tell you.
And talk about that, what the majority of trainers would tell you and what people have been saying for years.
Well, I mean, what people have been saying for years is what we just talked about a little while ago, the argument between what's the best way to train. Do you do tons of sets, with lots of reps, or do you do few sets with very, very heavy weight? Which works better? And the reality is they both work, but you've got to get to the point of failure. And it's probably better to do intermediate number of reps to failure.
What would an intermediate number be? 12?
Somewhere between 10 and 15, 20 at the most, to failure, because that way you exhaust your slow twitch fibers first, and then as they start to fail, then you recruit your high twitch, your fast fibers after that. So by the time you're done with the set, you've exhausted everything.
And so to do that, could you do drop sets?
You could do drop sets to do that with almost no weight in between to bring the muscle to exhaustion.
So a drop set is like, maybe you'll start with, I did drop sets today for like extension, so I think I was doing I was on 90 pounds. I don't know. Anyways, say I was on 90 pounds. So I did 90 pounds for as many as I could, and then I dropped down to 50, and then I dropped down to 40. No, I didn't. But anyways, that's the idea, that you would drop your weight and keep going, try to go till failure, and you exhaust your muscle fibers.
Yeah. You have to be careful with things like drop sets and forced reps and things like that. They're very good to do occasionally. If you do them regularly, you'll get overtrained.
Oh, really?
You'll go in the tank. Yeah,
Why
you
is
shouldn't,
that?
because you just exhaust your muscle past the point of easy recovery, and you'll take 15 days to get over your workout.
So then how many times a week should you do drop
You
sets?
should do it occasionally.
Oh, like once a week?
Yeah, like at the most,
Oh,
probably.
Jeez Louise, I just learned
I
something
mean,
new again.
The recent data shows that it takes people a lot longer to recover than they think. And I'll give you a very good example of that. When I used to work with David Martin in Atlanta, David Martin he's retired now, professor of physiology at Georgia State. He was head of middle and long distance running for the Olympic Committee. He hosted the cross country, the international cross country championships in the U.S. 3 times. He was a coach on the Polish Olympic team.
Very cool guy.
And the only American that was welcome in the Russian Olympic training camp who could just walk in because they loved David because he was so helpful. He was the world expert in the high jump.
Yep.
And so we used to work with high jumpers, and I'm talking about gold and silver medalists. And at one point in time, we had Jacek Zwola from Poland, who was the world record holder and Olympic gold medalist, with us in Atlanta with a foot problem, working on him. And Greg Joy was down from Canada. He was the silver medalist at the same time. And those guys both jumped, I don't know, 6'8" or 6'9", unbelievably good jumpers. And they were, especially Greg, was getting hurt all the time, and we couldn't figure out why. And so David and I sat down and we thought about it, and we thought, maybe these guys are overtraining, maybe they're overtraining. And so let's look at their training. So we took them both and we worked them with a very hard set of partial squats, like 750 pounds for quarter squats, several sets. And then we said, okay, you guys are more in tune with your body than anybody else in the world.
Like 99% of people.
Yeah, and you tell us, and we had put them on the Cybex first, and we measured their maximum strength.
What's the Cybex?
Cybex is an isokinetic machine where you can measure strength curves.
Okay.
At different speeds. And so we put them on the Cybex first, and we measured their speeds. We knew their maximum strength. And then we let them tell us when they were recovered from their weightlifting session to go back to jumping. We put them back on the Cybex. They were both down 25%. They thought they were normal, and they weren't close. And those are guys that know more about their body than anything else. So the tendency for athletes when they're not doing well is to train more.
And that's exactly how volleyball was for me, and especially with my coaches, when we weren't winning, it was because we weren't training hard enough. And so we needed to squat heavier and do more reps and practice more. And what ended up happening was you get a whole bunch of people that are overtrained. They're psychologically and mentally just fatigued and exhausted. They can't give any more. And then you go out to play and you get creamed again, and it's like this vicious cycle. And I remember talking to you about that I had to go talk to the coaches because I was just like, hey, like, we're all overtrained. And as Americans, we think like more is better. We need to do more. You'll get better improvements, and that's not necessarily true.
The reality is that less is better. Good example of that is Allison Felix, the world record holder at 200 meters. Her weightlifting training she's phenomenally strong, but her training has always been very brief, and it's backed off during her competitive season.
Is she a sprint? She's a sprinter.
She's a sprinter,
okay.
Yeah. She's placed in the Olympics in the 100, and she holds the world record at 200 meters.
Okay.
Great girl too. I mean, just very well spoken. Really, really nice person. But the coaches that train a lot of high-level athletes now are thinking more and more that during season, weight training should probably occupy 10% of your time, and the rest of it should be sport specific. So ideas of training are really changing. The same thing with ideas of fitness training, aerobic training to get cardiovascular fitness. The old ideas used to be that you went out and you ran long distance. The data shows that that's not the best way. The best way are short sprints with short rests with maximum intensity. And the first studies on that were done by Dr. Tabata in Japan with speed skaters.
Oh, and that's like the Tabata
The
today.
Tabata protocol that you hear now, that's from Dr. Tabata in Japan, and it was with speed skaters. And it's short duration exercise that lasts 4 minutes. Total exercise time.
But you're going
4
out
minutes.
like as hard as you
You're
can.
going 20 seconds on, 20 seconds off, and you should not be able to finish the last of your 8 repetitions. So you should be totally exhausted. And that produces better improvement in both aerobic and anaerobic fitness than all the other stuff that we used to do in the long jogging and all that kind of stuff. It's a much better way to train. But it's not pleasant.
We're going to take another short break, and we'll be right back. I'm Miley Scarpino. I'm your host, and I'm here with my dad today, John Scarpino, orthopedic, and he does occupational medicine at Honolulu Sports Medical Center. So we will be right back. Thanks, guys.
Aloha, Yappers. This is your host, Kingsley, for the Yap Show. Every Friday, 3 p.m. to 4 p.m. Eastern Time. You can catch us here live, Think Tech Hawaii, and then later on, we upload to our YouTube channel. We talk about youth issues, policies, youth programs, and how to transition yourself into adulthood.
But this was like a sign, I guess. Hey, life's like, hey, right. Now's your chance to go back to school, which I'm doing.
Catch us here again live, 3 p.m. to 4 p.m. Hawaii Standard Time. Aloha.
Welcome back. I'm Miley Scarpino. This is the Empower Hour. I'm here with my dad, John Scarpino, orthopedic, and he practices occupational medicine at Honolulu Sports Medical Center. We were just finishing talking about training and different training aspects and philosophies, and we kind of skipped your credentials, so we need to talk about that. Why are you allowed to talk about this stuff and give us information on it?
Okay.
It's important, because you have a lot of credentials.
Yeah, well, I'm an orthopedic surgeon. I went to medical school in Boston at Tufts University. I did my orthopedic residency and my internship at the University of Minnesota, where I had the privilege of working with a lot of very famous doctors, the Lillehei brothers, who were the pioneers in transplant surgery and the first people to do open heart surgery. And
I remember you telling me what were you doing rounds or doing your internship? You took care of a lot of the open heart patients.
Yeah.
And that wasn't something that
as an orthopedic surgeon resident, I used to babysit C. Walton's patients for him that he did in the private hospitals.
Private wing.
But C. Walton was a really interesting man. He was the first guy to do open heart surgery and valve surgery. And in order to do that, you have to stop the person's heart. Well, there was no pump oxygenator at that point in time, and there was no way to stop the patient's...
What's a pump oxygenator?
Pump oxygenator is a machine where you hook the patient's artery and vein up to a machine that pumps the blood through, takes out the carbon dioxide, puts new oxygen in, and then pumps it back into the body so that everything stays alive when your heart isn't working.
Okay.
So it's essentially like an artificial heart outside of the body. And there was none at that point in time. So C. Walton decided that he would take a relative of the same blood type, and he would put the relative and the person to sleep, and he'd hook them up together and use the healthy relative to pump for both.
That sounds horrible.
Which he did initially, and his first patients obviously didn't survive. I mean, it didn't work well at first, but then he got to the point where it was working well, and then in his lab at the University of Minnesota, they went on to develop the pump oxygenator, and after they developed that, then you didn't have to use somebody else as the heart for people when you stopped their heart. So that was all done at the University of Minnesota, where I was for my internship. And I did my residency in orthopedic surgery there. As I said before, that's where I got very interested in a lot of the athletic stuff that I was doing, the weightlifting and that kind of thing. Then I was very interested in sports medicine, obviously, at that point in time, and had a wide experience in sports medicine and rehabilitation. And that was in the period of time when we went away from passive treatment of injuries. Oh, you need to go to bed for 2 weeks and rest. Oh, don't do anything.
Mm-hmm.
And we started looking at microscopically at the healing of tissues, and we found out that tissues heal much better when you're active than if you don't do anything. And so that was how the idea of sports medicine and active rehabilitation started. And I was very interested in that. And I've always worked close with physical therapists, and I was head of spinal rehab for the American Back Society in the past. And as I say, I worked with all kinds of Olympic athletes. I was the doctor for the Karate Association, worked with all of them in all different aspects of it. Aspects of fixing injuries, but also aspects of improving performance.
Right, and that's something that's really important to you and kind of unique to you too, is that you encompass everything. And
Yeah.
just like the client you were telling me about, like that you saw today, and how, you know,
Yeah.
you took aspects of everything that she was being treated for from 3 different people and
Who
saw
weren't
her.
talking to each other, put it all together and came up with a different diagnosis of which every treatment was a part.
Right, right. So, I mean,
So-
that's something that you do, is you take into consideration all aspects. And
Yeah, and when you're looking at performance, you have to look at what somebody's abilities are, what their alignments are like, what they can do, what they can't do, and then help them figure out a way that works best for them. And I mean, I've explored all kinds of stuff. There was a while I was working with a psychologist in Atlanta who was teaching race car drivers to distort time so that when they were driving, things would appear much slower, and they'd be driving 120 and they would feel like they were driving 60. And their brain would be processing things much faster, but to them it would appear that they were out for a Sunday drive. So we started doing the same thing with the fighters and teaching them to distort time so that punches would come more slowly, and they would think they would have more time to
What was
react, but they would react even.
what was the treatment like behind that? Like that the psychologist would do?
They were using hypnosis.
Okay.
And teaching the patients under hypnosis to distort time, showing them different things, and having them visualize stuff and having it be slow. You're going 120, but it's like you're 60, you're shifting into second gear, and they would set up all these scenarios and visualizations and teach them how to distort time.
That's interesting.
Yeah. So we've explored tons of different things like that over the years, looking at ways to improve people's performance. And that's why I love the Olympic Training Center so much, because we had our own team of top coaches, physiologists, podiatrists, psychologists, orthopedic surgeon.
Everybody working together.
And plus had a track that has a rail around it with a little train that goes along with cameras, so you can video the person's stride and how they're doing, and when they're fresh, when they're tired. And then you can and then we had a big trailer, and you can slow-mo all that stuff and look at people, look where their problems are, figure it out, and then between the bunch of you, figure out physiologically how you're going to make it better. And then try different things, try shoe inserts, try this, try that, and then re-video them and see how they're doing. And it was just fascinating to do that,
So how have you seen like training and even medicine from the past? How is it changing? How's it evolved? Or, I mean, I'm sure that there are positive things that have happened over the years, and even some deficits in the medical field.
Oh, I think it's very interesting. I don't think anything new really happens, but what happens is...
Trends get cycled, right?
Trends get cycled.
Like knee replacements.
And something that didn't work 30 years ago, now with improvements in bioengineering and in metals and plastics and stuff, we can do things that we couldn't do before. I mean, if you look where we started, you said total knee replacements. Well, that started with Townley replacements for people with arthritis, and it was a little piece of metal that was irregular on the bottom, and you'd cut a chunk of the bone out and you stuck that in there on one side of the knee joint. And it made some people better, and then we advanced to the total knee replacements, and the first total knee replacements were a skinny runner with a little plastic track. The runner went in the femur and the thigh bone, and the little track went in the top of the tibia. And Dr. Gunston made those in his garage in Canada. And he came down to the University of Minnesota and to Mayo Clinic, and we were the first ones to start putting in the Gunston knees. And then we went for the Gunston, but they didn't rotate, so they would come apart because the knee rotates. And so then we figured that out. So then the next thing had to be the geometics, which allowed rotation. And we worked all the way up to where we are now with, you know, the robotics and things where we can do minimally invasive stuff, and we're going to get to the point where we can do things three-dimensionally, like computer games eventually. That's where we're going, where we'll be able to do things through little teeny holes, and somebody will be outside manipulating instruments and stuff, looking at it in 3 dimensions on a video screen. And that's where we're going with surgery.
How do you think like treatment of patients is going?
Not as good.
Yeah?
I think that, you know, we've gotten very subspecialized now, and I think treatment as far as joint replacement, stuff like that, is probably better, but the doctor-patient relationships are different than they used to be. I mean, it used to be that you had your family doctor or your GP, and that guy had been your mom and dad's doctor, and he was yours, and he was going to take care of your kids until he retired. And he knew the family, he knew what they were like, he knew what their pain tolerances were, he knew everything about you, you know?
Right.
And there was a real trusting relationship there. Now, with health plans and stuff, you just get used to somebody you like, and next year they change, and you don't have that doctor anymore, and you get sent to somebody else. And so I think a lot of the doctor-patient relationship has changed, also with decreases in payments and increases in your need to see more patients in a day. The amount of time you have to spend with somebody has gone way down, and so you get just focused treatment. You know, you may come in and you say, oh, I have, you know, a sore finger, and that's the only thing you're going to get looked at today. You won't get anything else looked at. You won't get a holistic treatment from a doctor that knows your whole
And it's important
body.
that you do get that holistic treatment, because it could be something else leading to your finger hurting, not just the finger itself.
And you know, the average time a doctor has now to look at you is between 7.5 and 10 minutes.
Do you think there's a way that that could be changed?
In the current system that we're in now, no, I don't. Because reimbursements have been cut back, so you don't get paid as much, and at the same time, the amount of money that it takes to run your office has gone way up. So the margins have gone way down. You know, again, I'm going to talk like an old timer, and I think things were much better when I was a resident as far as care is, and when I was first out. We were trained to never turn anybody down.
Right.
It did not matter if they could pay or if they couldn't pay. You took care of everybody exactly the same.
The whole purpose was to make people better.
Right. The whole purpose was to make people better.
And I even see that with some of my clients, like they get subpar care. You know, they come in and like you said, they're suffering from such and such, and that's all that they look at, but they don't look at the medication that they're on or anything like that.
Yeah.
And a lot of times it's the medication. I had one client that didn't even, he's a first generation man, you know, from the Philippines, and he can't read. So he didn't know what meds he was supposed to be taking, and I think that's something that doctors even need to consider, like, does my patient speak English? Can they read?
Yeah.
Are they understanding what I'm telling them? Because if not, that leads to other problems. He wasn't taking his meds correctly.
No, I'll give you an example. I mean, when I used to have my private practice and take care of a lot of patients, I knew everything about, you know, my patients. And it's just funny what kind of a relationship you develop, because I had one family that had all kids that I called kamikazes, because they were, one or the other one was always broken, and the mother, when they were 7 kids, and the mother was always bringing one in with something broken. And the mom and dad went on vacation, and I get a call from this 10-year-old girl at about 9 o'clock at night, and she says, "Hi, Dr. Scarpino, this is so-and-so," you know, and I said, "Oh, hi." She said, "I'm calling you because my brother fell out of the tree and his arm is bent, and we have a babysitter and she's going nuts and doesn't know what to do. Shall I just she just take him to Shallerford where you always meet us when something is broken? And I said, yeah, just, go ahead there. So, I mean, you get to know your patients. They feel comfortable with you. You have a system that, works with them. And you have a very trusting relationship. And I think that that's going out of medicine now just because of technology and the need to do things quickly. Are the surgical techniques better? You're darn right they are. Can we do things that we couldn't do before? We certainly can. But I think in some ways the human aspect is going away, and to me that's problematic, because I think that's very important.
It's one of the number one things in all aspects of life.
Patients do well when they think they're going to do well and when they trust the person that's taking care of them. I can remember learning that when I was an intern and going in to see a lady pre-op, a young lady who had rheumatic heart disease, and she had 3 bad valves in her heart, and she was 23 years old. And this was in 1966, and open heart surgery was just starting.
Brand
and
new.
The survival rate with a triple valve
Was very low.
very, very low. And we went in there with the surgeon who happened to be Aldo Castañeda, who was really a great heart surgeon, and later went on to be head of pediatric cardiac surgery in Boston at Boston Children's Hospital. And I can always remember he was very nervous about doing this lady, and she looked at him and said, "I trust you, Dr. Castaneda. Don't worry, I will do very well." And she did. And
That's
that was because
awesome.
there's a trust
There's a
thing
relationship
between the two of them, and she had absolute confidence and sailed through something that 99 other people would have died on the table.
Well, with that, guys, we're going to close out. This is the Empower Hour. I'm Miley Scarpino. I'm your host, and I was so happy to get to interview my dad today, John Scarpino, orthopedic surgeon, and he does occupational medicine at Honolulu Sports Medical Center. If you ever need anything, go see him. He's there. Anyways, thanks, guys. Have a good one, and see you next week.